call on Government Order of the Day number 3.
Interrupted debate on the first reading of the Health Practitioner Replacement of Statutory Reference to Medical Practitioners Bill.
The next call goes to the National Party. I call Jackie Dean.
Thank you, Mr Speaker. The Health Practitioners Replacement of Statutory References to Medical Practitioners Bill, I'm assuming enjoys wide support through the House. On the face of it, it looks like a pretty sensible bill. And as I have been reading the bill for the first time this evening, it seems on the face of it relatively in concept quite straightforward. And what this omnibus bill does do to a number of statutes is bring into line legislation with current practice. And once again, it's another piece of statute that's being brought to the House, which is modernising that statute to make it fit for modern times, and so it is with this bill. So medical practitioners or medically trained practitioners, including general practitioners, have for many years been the medical personnel who have had statutory duties under a number of pieces of legislation. And of course, current practice has changed now. For example, we have a much higher level of competency and training in a number of other health professionals, for example, nurses in particular, and other health practitioners as well. Also, healthcare in New Zealand, and as I often do, I refer back to my large rural constituency where health services are delivered increasingly away from the base hospital and towards where the local population lives, and that is a laudable move by this government and is working particularly well for the people who live in my communities. We are getting health services closer to where people need them, and another component in the delivery of those health services is to allow those highly trained health practitioners to now deliver some of those roles which have been the province so far of medical practitioners. So if I can simplify the bill, the omnibus bill, right down, in many instances the changes in this bill proposed for the statutes which it refers to changes references from medical practitioners to health practitioners. Now, health practitioners isn't just a term thought up by some officials in the Ministry of Health. Health practitioners are required to have competencies and knowledge, as you would expect, and the ability to perform a number of tasks. And I'm just going to go through some of the statutes which are covered in this bill. There are a number of them, and of course this is an omnibus bill. And it is interesting for those of us who are in this business that an omnibus bill is, it may be introduced to the House if the amendments to be effected to each Act are of a similar nature. And of course, in this case, this bill, as it's applied to those statutes, recognises the increasing skill levels of health practitioners. So if I refer to the Accident Compensation Act, so what that does is makes reference to a health practitioner rather than a medical practitioner, and that happens in Clause 7 of Schedule 1. And so what that means, if you go to Schedule 1, is that a health practitioner leading the coordination of treatment or rehabilitation of the claimant for ACC, they must instead be given the opportunity to participate in the preparation of the individual's rehabilitation plan. Again, that is using, wisely, the skills, enhanced skills of health practitioners. Under the Burial and Cremations Act, which is an older Act of Parliament, 1964, probably due for renewal. So a doctor's certificate, which is required by that Act, is going to be renamed to be a Certificate of Cause of Death. And that references to doctor in that piece of legislation will be replaced to references to medical practitioner. And so it is with the Children, Young Persons and Their Families Act. And this one is a very important act for children in particular, vulnerable children in the New Zealand legislative system. And so there is an equivalent duty to minimise distress to young children and young persons when carrying out medical examinations, and that goes on to health practitioners, so that it is in line with the duty of medical practitioners who do the same. So the benefits there, and I am looking forward to the Select Committee consideration of this bill, but the benefits there are that the focus goes on yet again under this government into what is good for children, and having the ability for a health practitioner who may have an existing relationship with the child under care now has the ability to undertake procedures, medical examinations, rather than just being confined to a health practitioner. The Act also amends the Holidays Act, the Act amends the Land Transport Act, and I'm not going to go into each piece of legislation. There are other members who I know are very keen to speak to those particular acts in particular. I know that my colleague Scott Simpson is particularly keen on focusing on the Holidays Act and the Land Transport Act in his initial contribution, so I'm going to leave those up to him. I just want to finish my contribution with a couple of comments on our health workforce, because of course the impacts of this omnibus bill, once it is passed, will have a large impact on health professionals in New Zealand. Just to note, it's this government which is investing in the training of health professionals, which is why it is appropriate for us to be able to make these changes in the way health services are delivered to New Zealand. This, while a simple bill on the surface, has wide-reaching implications, and I commend it to the House.